friends. Today we are talking about hymenoplasty. Are you still in dilemma whether you should go for hymenoplasty surgery before your marriage or not? Are you still confused whether hymenoplasty and vaginoplasty are the same surgeries or different? And are you still looking for the best center in hymenoplasty surgery in Delhi NCR, which has experienced and qualified surgeons? Then friends, this video is for you. Hi, I'm Dr. Deepti Asthana. I'm Senior Obstetrician and Gynecologist and Director at Kalosa Aesthetic Clinic, Delhi NCR. I'm a trained cosmetic gynae surgeon. I've taken my training from American Aesthetic Association and I have been practicing cosmetic gynae in Delhi for last 7 years. Now this video is going to tell you all about hymenoplasty, what are the pre-op precautions you need to take care, and why post-op care is so important and an integral part of good hymen repair. You'll also get to know why doing your hymenoplasty surgery at Kalosa is special and different from other centers. Please subscribe to our channel Calosa Cosmetics for more plastic surgery and cosmetic gynae videos, and also you can log on to our websites www.kalosaaesthetics.com or kalosa.in. Girls, now let us talk about hymenoplasty. So what is the literal meaning of hymenoplasty of hymenography? Hymen is a thin membrane covering the vagina and raphy means suturing. So hymenoplasty is resuturing of the hymen. Now let us see what is the basic anatomical location of hymen. I have a diagram here and I'll tell you where is hymen, where is vagina, because I get many girls who are totally confused whether they want vaginoplasty also at the time of hymenoplasty, and some too even don't know what is the difference between hymenoplasty and vaginoplasty. Now see, if you look at the diagram, this is the uterus, this is the cervix, and this is the vagina. Okay, if we are doing the vaginoplasty, we are going to operate in this area. And if we talk about hymen, hymen is a thin mucous membrane which covers the vaginal end here. So if you want to get vaginoplasty done, you have to tell the surgeon at the time of hymenoplasty only, because then vaginoplasty is going to be operated first, followed by closure of the vaginal end, which is hymenoplasty. Okay, so vaginoplasty is here and hymenoplasty is going to be here. And vaginoplasty would be done first, followed by hymenoplasty. If we talk about function of hymen, there is only one physiological function of hymen, which is to cover the vaginal end, and during your first intercourse it gets ruptured, and for many people this is a sign of virginity. Now what is most important is people should understand that sexual intercourse is not the only reason why hymen gets ruptured. There are many other reasons why your hymen can get ruptured. Girls nowadays are using menstrual cups or tampons, so they can also have ruptured hymen. Also females who are doing athletic activities or sporty activities, they also can have their ruptured hymen. Also, if you are visiting your gynecologist for any medical reason, you may require vaginal examination and that may lead to torn hymen. Now, what is the need for hymen repair? There are many reasons why girls look forward to hymen repair surgery. The first and foremost being socio-cultural and religious beliefs. We'll not go into the detail, I think everybody knows. There are other reasons, like some people, they want to get past over their failed relationships and hence they want to get hymen repair done. Various medical reasons I've already discussed, and keeping at least 6 weeks to 3 months before their marriage so that their stitches can heal properly, they can take adequate rest, all the inflammation should subside and they have good results. You should understand that stitches will take 3 to 6 weeks to heal completely. So I always tell girls that when you're getting married, you're too busy shopping, you're too busy in preparation of your marriage. Of course, it is a big event in your life. So taking rest is not always possible, and you should understand one thing: post-op care is an integral part of good hymen repair. Hence, taking time before in hand is very important. So you should always try to get it done 3 months to at least 6 weeks before marriage. Also, I always prefer doing hymenoplasty surgery just post-menstrually so that we have sufficient period-free time, because constant rubbing of your pads can cause irritation as well as infection, which can disrupt these stitches. If your periods are in between, then I usually prefer postponing your next period so that we have sufficient menses-free time. What to expect on the initial day of consultation? Now, hymen surgery is a very delicate surgery, so we prefer doing it through microsurgery. We are fortunate that we are a team of cosmetic gynae surgeons, and we have an in-house plastic surgeon, Dr. Ashish Khare, who helps us in doing microsurgery and meticulous repair, which results in beautiful hymen reconstruction. We have been doing hymen surgeries in Delhi NCR for the last 7 to 8 years and have been really fortunate to get very good results. Now, when you're coming to us for the initial consultation, I prefer examining the patient myself. I look for any signs of infection. If you have any prior infection, I would like to treat it first, because infection may disrupt these stitches later on. If we have any international patient or any outstation patient, we prefer giving empirical treatment for PID prior to the surgery, at least a week prior to the surgery. I would also like to assess the amount of hymenal tags we have, because the amount of hymen which are left over, that will decide which kind of surgery would be best for you. Also, I assess the patients whether they require any vaginoplasty along with hymenoplasty or not, because as I told you, the decision for vaginoplasty has to be taken at the time of surgery. We cannot decide for vaginoplasty after our hymenoplasty surgery is done. Now, at the time of initial consultation only, we tell the patients what are the various techniques available. The patient can choose the available techniques depending on their budget. Also, we have the option of doing hymenoplasty surgery under local anesthesia as well as general anesthesia. That all depends your threshold of pain. Also, now what are the contraindications for the surgery? The general contraindications for the surgery are: if you have any malignancy of genital tract, we don't prefer doing the surgery. If you have any bleeding disorder, or if your general medical condition is not good, then we would not prefer going for hymenoplasty surgery. And now, if you have agreed for hymenoplasty surgery, we tell you to get some general blood tests done to assess your general medical condition. Also, we are getting COVID test done these days. And if you're taking any medicine which can hamper the surgery, example any blood thinners, then we tell you to stop it 3 to 5 days prior to the surgery. Now, what to expect on day of surgery? Hymenoplasty surgery is a very short daycare surgery. So, patient is required to be at the clinic merely for 3 to 4 hours. I get many outstation patients which come the same day. And if possible, I tell them to rest for a day and then go back to their own cities. If that is not possible, if you can travel to a very short distance, then it is usually allowed. Since it is a cosmetic gynae surgery, we don't expect any attendant to come along, but if they are coming along, that would be preferred. Also, the consent can be given by patient alone, since it is a cosmetic gynae procedure. Now, patients should be reassured that since this is a cosmetic gynae procedure, their identity would be fully kept under wraps, and whatsoever may happen later on, their names would not be revealed to anybody. Now, after general consent of the procedure, we ask the patient to get local anesthesia sensitivity test done. We would prefer patients trimming their hairs 2 to 3 days prior to surgery so that there are no fresh cuts at the area of operation. If everything is well prepared, then it is easy for us to go ahead with the surgery. Now coming to the diet, if the patient has opted for general anesthesia, then we tell the patient to be fasting for at least 6 to 8 hours. But if the patient has opted for local anesthesia, then we tell the patient to have light diet and then come for the surgery. Most of my patients, they prefer doing the surgery under local anesthesia only because pain is easily tolerable and pain later on can be easily taken care of by analgesics, oral analgesics and anti-inflammatory drug. So general anesthesia is rarely required for the procedure. But if your threshold is very low for the pain, you can opt for general anesthesia. Now coming to the surgery, the surgical time is usually 30 minutes to 2 hours depending on the technique we have chosen. The hymenoplasty surgery is really special because it involves loop magnification as the membrane is very delicate and hence the need of plastic surgeon involved is justified. Plastic surgeon does the job meticulously and we have beautiful reconstruction. We use micro instruments and also the suture used for the hymenoplasty surgery is very thin, transparent and which cannot be easily seen. So there are various techniques for hymen surgery as I told you earlier. If you're going for single layer closure, we just freshen up the margins of the hymen and then close it. Since it is just a single layer repair, sometimes it may give up and your stitches may open up. The more better and refined surgery is double layered closure or multi-layered closure, which involves micro dissection. Here we cut the flap into 2 or 3 layers and then stitch each layer. Now this is more reliable and it is considered to be giving more strength. If the hymenal tags are very less and very minimal, then sometimes we take vaginal flaps also. There is a hole, very small hole left in the center of the hymen to give it a natural shape and also to allow the menstrual blood to come outside. Post-operatively, we keep the patient in our clinic for half an hour to 1 hour to look for vitals and to look for any other problem if the patient is having. We usually allow the patient to travel, but they should take precautions that they should not walk very vigorously, there should not be any running, and for next 3 days they are expected to take adequate rest. There should not be any widening of perineum, so any activity which involves widening of perineum should be avoided. Like gymming, aerobics, running, this should all be avoided. Antibiotics and anti-inflammatory drugs, they are given to take care of post-op pain and inflammation. Patients can apply ice packs to decrease pain and inflammation also. Gradually they can increase their activity, but sexual intercourse is prohibited for next 6 weeks and also any vigorous activity should not be started before 3 weeks. In post-op care, local hygiene plays an important role. You should all take precautions to maintain good local hygiene. After every toilet visit, you should wash your local stitch area and take care that there is no infection. Also, there should not be any squatting activity. People who have temptation to check their stitches or do fingering should completely avoid this. We promote plenty of waters to avoid any urine infection, and there should not be use of any cigarette smoking or alcohol to promote good healing. Now coming to complications of hymenoplasty. Thankfully, complications of hymenoplasty are very rare. You can have infection, but we take all the precautions to help you avoid these. Also, there can be mild bleeding for initial 2 to 3 days. There can be local hematoma formation. If there is excessive bleeding, some internal vessel bleeds, then you can have hematoma. Also, if the opening which is left is too small, you can have collection of blood inside. which usually needs drainage later. Now, coming to a very important point. What decides the pricing of hymenoplasty surgery? I often get phone calls from girls and the only question they want to ask is, what is the price of hymenoplasty surgery in your clinic? Now let me tell you all girls, please be wise. Please be wise in choosing your clinic and please look at various factors which decide the pricing of hymenoplasty surgery. Number 1, the qualification of your surgeon. A well-qualified surgeon cannot be equal to a less qualified surgeon. So be prepared to go for better pricing if you're choosing a better surgeon. Number 2, what is the technique you're opting for? What is the suture material you're opting for? What instruments are your doctors going to use? And where is your surgery going to take place? Are you going to do the surgery in local anesthesia or whether you are going to go for surgery in general anesthesia? These are all the factors which decide your final pricing. So girls, be wise in choosing your clinic and please choose according to your budget. Now, why choose Kalosa for your hymenoplasty surgery? A Kalosa clinic is blessed with a rare combination. I'm a cosmetic gynae surgeon, so I take care of the patients initially. I examine the patient, I decide whether patient needs vaginoplasty or not, and patients can be made comfortable with me. We also have a plastic surgeon, as plastic surgeon uses micro dissection technique very beautifully, and we can go for your hymenoplasty surgery with any technique you prefer, whatsoever the dimensions of leftover hymenal tags are. We are confident in going for vaginal flaps also if your hymenal tags are very, very small. Now, combination of cosmetic gynae surgeon and a plastic surgeon raises the bar of quality care given at our center Kalosa Aesthetic Clinic, and your surgery is designed according to your budget, need and expectations. Also, the complication I just mentioned, these are very rare in our clinic as we are well experienced surgeons. You will have good ambience in our clinic and you can be reassured that we are going to do it with all medical ethics. We understand that this is a delicate matter, so your identity is completely kept a secret, and whatever issue arises later on, we never indulge in giving your details to anybody. Post-operatively, all the patients are followed up telephonically, and we ask the patients to follow up in our clinic after a month. We have records of innumerable patients and who are very happy with their results, and now they've become our regular patients after their marriage. So hope you have had good knowledge about hymenoplasty today. Please subscribe to our channel Kalosa Cosmetics for plastic surgery videos and cosmetic gynae videos. You can also log on to our websites kalosaaesthetics.com, kalosa.in and also drdeeptiasthana.com.